Welcome to this week's instalment of Wellness Weekly. Today I wanted to discuss the very important issue of drugs and how they relate to the health of an expectant mother and her unborn child. Specifically, we'll be looking at the over-the-counter medications. We have found in our office that many expectant mothers are frequently aware of the dangers of recreational or party drugs. However, surprisingly, many women are unaware of the dangers associated with over-the-counter medications. A commonly held belief is that taking antibiotics is safe for pregnant women. In fact, the Journal of Respiratory and Critical Care Medicine performed a study which involved analysing the medical records of 25,000 children and their mothers. The results found that women who take antibiotics during pregnancy are more likely to have a child with an allergy-related condition, such as asthma, eczema or hay fever, than women who do not take medication during pregnancy. The authors noted that, and I quote, "Because a person's immune system develops while he or she is still in the womb, drug exposure at this time may have a long-term effect on the risk of developing allergic disease." How can a drug have an effect on the developing baby? Well, consider a 75-kilogram pregnant mother who takes a drug which crosses the placenta undiminished. Her baby may weigh only 100 grams at the time. This means that the child has 750 times the drug exposure per kilogram of tissue than the mother does herself. When looking at this, it is easy to see how the taking of medication can have an enormous effect on the health of the developing baby. Research has also demonstrated a link between non-prescriptive cough medicine, birth defects and miscarriages. A medical researcher stated in the Pediatrics Journal in 1998 that, and I quote, "We feel that a single dose of cough medicine is capable of causing a birth defect and that ultimately it could be the cause for a woman to have a miscarriage." The list goes on. Corticosteroids in breast milk can lead to suppression of growth. Anti-inflammatory drugs can prolong labour. Aspirin increases the likelihood of bleeding in both the mother and the baby. Migraine medications will cause uterine contractions that may result in premature labour. The good news is the expectant mother can decrease her need for drugs by adopting a wellness approach to her lifestyle. This includes eating well, getting regular exercise, getting adequate and quality sleep, minimising stress, as well as ensuring your nervous system is functioning at its optimum. That is why so many expectant mothers in our community are turning to chiropractic. Chiropractic care throughout the pregnancy works by reducing biomechanical stress and enhancing nervous system function, thereby providing greater health potential for both the mother and the developing baby.